This guide is for educational purposes only, and should be used by healthcare professionals or under the supervision of qualified medical staff. Proper assessment, monitoring, and hospital protocols must be followed when administering any injection. Life in Scrubs is not responsible for misuse or incorrect administration. Always refer to updated clinical guidelines, drug references, and patient-specific factors before treatment. Top 5 injections that should not be given fast. Full details. 1. Potassium chloride, KCl. Rapid infusion can cause dangerous cardiac arrhythmias and even cardiac arrest. High concentrations can alter electrical activity in the heart, leading to life-threatening complications. Dilution: 20 mg in 500 ml saline or as prescribed. Infusion rate: 10 mEq/hour, peripheral line. 20 mEq/hour, central line with monitoring. Monitoring: continuous ECG, serum potassium, and urine output. Stop infusion immediately. Administer calcium gluconate to stabilize cardiac membranes. Give insulin with glucose to shift potassium into cells. Use sodium bicarbonate if metabolic acidosis is present. Dialysis in severe cases. 2. Morphine. Fast injection can lead to respiratory depression, hypotension, and excessive sedation, especially in vulnerable patients. Reconstitute as prescribed. Inject 2-4 mg slowly over 4-5 minutes. Monitor respiratory rate and oxygen saturation every 5 minutes for at least 30 minutes post-administration. Provide oxygen and airway support. Administer naloxone, Narcan to reverse opioid effects. Continuously monitor until stable. 3. Phenytoin. Rapid infusion can result in arrhythmias, hypotension, and central nervous system effects like dizziness or confusion. Mix with normal saline only. Infuse at a maximum rate of 50 mg per minute. Continuous ECG and blood pressure monitoring is mandatory. Stop infusion at once. Treat arrhythmias with antiarrhythmic drugs as per protocol. Manage hypotension with IV fluids. Provide respiratory support if needed. 4. Epinephrine, Ivor. Fast IV bolus may cause severe hypertension, arrhythmias, and risk of stroke or cardiac arrest. Use diluted concentration during emergency care. Administer small boluses, 10-20 mcg every 2 minutes. Monitor heart rate, rhythm, and blood pressure continuously. Monitor heart rhythm and blood pressure closely. Treat arrhythmias per ACLS protocol. Control blood pressure spikes with medications if required. Support airway and breathing. 5. Diazepam or other benzodiazepines. Rapid injection may cause respiratory depression, hypotension, and cardiac arrest, particularly in elderly or compromised patients. Inject over 1-2 minutes only. Observe respiratory function closely. Keep airway management equipment ready. Provide oxygen and assisted ventilation if needed. Administer flumazenil, a benzodiazepine antagonist, cautiously. Monitor blood pressure and neurological status continuously. Always assess patient history, allergies, and current medications before injection. Attach ECG, pulse oximeter, and blood pressure monitoring devices prior to administration. Use infusion pumps whenever possible to ensure controlled delivery. Document vital signs and adverse effects meticulously. Train staff to recognize early warning signs like dizziness, slow heart rate, or breathing difficulty.